Today, I will identify 3 exercises, activities, or techniques that will assist you in enhancing your sexual performance and function. I'm confident you've never encountered the final one before, and the scientific evidence supporting these methods continues to grow with each passing year. Hello everyone, and welcome back to this health-focused content. As we understand through decades of urological research, erection is fundamentally a vascular phenomenon. Naturally, it also involves neurological, hormonal, emotional, and psychological factors, but for a complete and satisfying erection, blood must reach the penis with optimal flow and volume. To accomplish this, vascular health must be in excellent condition. These exercises associated with improved erection help enhance irrigation of the pelvic floor musculature and overall vascular wellness, creating a foundation for long-term sexual health. Blood reaches the penis through oxygen-rich blood vessels called arteries, and understanding this pathway is crucial for appreciating how these exercises work. These arteries are small branches that originate from larger arteries or vessels, forming an intricate network that supplies the erectile tissues. Penile blood flow begins in the internal iliac artery, which is actually a branch of the abdominal aorta, the primary blood vessel in our body that carries oxygenated blood from the heart to all organs. The internal iliac artery branches into the internal pudendal artery, which serves as the main arterial branch associated with penile blood flow and erection. This complex vascular system demonstrates why cardiovascular health directly impacts sexual function. This internal pudendal artery gives rise to other smaller branches, such as the cavernous arteries, the penile artery, and the dorsal artery of the penis. These are the vessels that actually irrigate and deliver that oxygen-rich blood, which will provide a satisfactory and complete erection for the patient. If blood circulation is functioning well, your erection will be good. This is why we prescribe vasodilators such as tadalafil and sildenafil for many patients with erectile dysfunction. As they are vasodilators, the arteries become dilated, allowing for improved blood flow. However, these medications work best when the underlying vascular system is healthy, which is where these exercises become invaluable. Similarly, these pelvic floor exercises and the techniques I will mention all 3 contribute to improving vascular health and enhancing the irrigation of this penile circulation. The beauty of these methods lies in their natural approach to addressing the root causes of erectile dysfunction rather than simply masking symptoms. The first technique involves perineal exercises, also known as Kegel exercises, which stimulate the pelvic floor muscles. These exercises were originally developed by Dr. Arnold Kegel in the 1940s for women with urinary incontinence, but research has since shown their tremendous benefits for men. The pelvic floor muscles are involved not only in the proper functioning of erection and ejaculation, but also in urinary and fecal continence mechanisms. These muscles form a hammock-like structure that supports the pelvic organs and plays a crucial role in sexual function. These exercises of lifting, contracting, and relaxing the pelvic floor can be performed at home, making them incredibly accessible. Ideally, it's beneficial to consult a specialist, a physical therapist specialized in the pelvic floor, who can assess your specific needs and create a personalized program. However, a tip to better locate these muscles is as follows. When you are urinating, try briefly stopping the flow of urine. The muscles you use, the muscles activated when you stop and interrupt the urine stream, those are the muscles you need to stimulate when lifting, contracting, and relaxing the pelvic floor. Another tip involves timing and progression. Start by contracting and relaxing these muscles for 5 seconds. Perform a set of 10 repetitions, 2 to 3 sets per day for a minimum of 6 weeks. As you build strength, you can gradually increase the duration of contractions and the number of repetitions. This represents one of several protocols that can help you improve your sexual and ejaculatory function, with many men reporting improvements within 4 to 6 weeks of consistent practice. The second technique involves exercises with a penile vacuum pump or vacuum therapy, a method that has gained significant recognition in urology over the past 2 decades. Vacuum therapy is a modality used in the rehabilitation of erectile dysfunction, for example, in cases after radical prostatectomy, where nerve damage may have occurred. It is also included in protocols to improve erectile function for many patients suffering from this condition, regardless of the underlying cause. Vacuum therapy involves using a penile pump, which is a cylindrical device attached to the penis, to create negative pressure, increasing blood flow and thus facilitating an erection. The mechanism works by creating a vacuum that draws blood into the erectile chambers, similar to how natural erections occur but through external assistance. These penile pumps are easy to find and can be purchased online, either automatic or manual. Automatic ones are generally more recommended for their practicality and consistent pressure control, but I suggest that before buying any device online, you consider seeing a physical therapist specializing in the pelvic floor so they can recommend the best device for you, preventing you from wasting money on ineffective or potentially harmful products. As I mentioned, it's a cylindrical device attached to the penis, creating a seal, which will increase blood flow through a negative pressure mechanism. This can be performed for 10 to 15 minutes, and will provide an erection that can last for some time after the device is removed. Some patients may use a silicone ring at the base of the penis after removing the pump to help maintain the erection for sexual activity. All of this needs to be done with professional guidance, at least for the first time, to avoid causing damage to your genital organ, such as ischemia, pain, and local necrosis, which are the main complications associated with improper use of the penile pump and constriction ring. Proper education on the correct pressure levels and duration of use is essential for safety and effectiveness. This vacuum therapy modality can be used 2 to 3 times per week for therapeutic purposes. Some patients even use it daily, but for a maximum time of 15 to 30 minutes to avoid causing damage to local tissues. The consistency of use is more important than frequency. Some studies associating the use of tadalafil with vacuum therapy show that patients exhibit better rehabilitation and recovery of their sexual function when compared to those using only the vasodilator, just tadalafil or sildenafil without vacuum therapy. In third place is the use of the penile extender, a device that is not widely discussed or known, but is frequently used by physical therapists in sexual function rehabilitation protocols, and also in some penile lengthening protocols. This device represents one of the most innovative approaches to non-invasive penile rehabilitation. Have you ever heard of it? Let me know in the comments about your experience, if you've heard of it before, or if this is new to you. Although this device can be easily found online, it should be custom-fitted, and even the traction should be regulated according to a specific study protocol developed through clinical research. These observations are important to ensure the expected performance is achieved safely and effectively. The principle behind penile extenders is based on the biological concept of tissue expansion through controlled traction, similar to methods used in reconstructive surgery. Some studies have already shown that using a penile extender for 1 to 2 hours per day for a period of at least 3 to 6 months can contribute to improved sexual function, erection quality, penile vascularization, and also leads to penile lengthening in a good number of cases. The device works by applying gentle, consistent traction that encourages cellular division and tissue growth over time. However, as I mentioned, it's important for the patient to be diligent about its use. Use a device appropriate for their size and penile length, gradually increase the usage period according to the recommended protocol, and persist with the treatment for the full duration to see optimal results. Patient compliance and proper fitting are crucial factors in achieving success with this method. Therefore, practice these 3 exercises consistently, and you will notice a significant improvement in your sexual function, your erection quality, and your confidence as a man. These techniques, when performed correctly and consistently, can provide substantial benefits for vascular health and sexual performance without the need for medications or invasive procedures. The combination of all three methods, when appropriate for your specific situation, can create a comprehensive approach to sexual health that addresses multiple aspects of erectile function simultaneously.